One may ask themselves, what is the deadliest animal in the history of mankind? Well, it is not a species of crocodilian or snake, or even feared big cats such as jaguars, tigers, or lions. No, the deadliest animal in mankind's history is the unassuming mosquito, which carries a vicious cocktail of deadly diseases such as malaria, dengue, Zika, and the subject of today's video, yellow fever. Washington Weedon was born in 1860 and would soon become a prominent medical doctor in the Tampa Bay area. However, his main specialization was in the study of the mosquito-borne illness, yellow fever, which had come from West Africa via the slave trade. The first symptom is a fever of 102 to 105 degrees Fahrenheit with headache, pain, nausea, and severe vomiting. The second stage sees the fever fall and the patient feel better for several hours. Then the third stage begins. A high fever quickly ensues, and the more severe form of first stage symptoms reoccur. Liver, heart, or kidney failure soon follows, with the afflicted suffering from severe jaundice with a yellowing of the skin. After about 5 days from the onset of the third stage symptoms, death comes. But however, some will survive, usually with the symptoms happening for around 15 days before going away. Tampa had been relatively free of the dreaded yellow jack since 1871, but that would all change in 1887. In May of 1887, news would reach Tampa that the fever had broken out in Key West. And by July, a refugee station was established on Edgemont Key at the mouth of Tampa Bay. And by mid-August, the cases in Key West were on the decline. But around the same time, the yellow jack would hit Tampa. In early September, a barber and fruit smuggler by the name of Charlie Turk would come down with the fever and would be the first death of the new epidemic. While physicians were hesitant to call the disease yellow fever at first, by October 4th, an official declaration was made. This would spark a panic, with many fleeing the area in fear of the disease. However, yellow fever has an incubation period where one does not know that they are sick, and the disease would be taken by these refugees wherever they went. Jacksonville would even issue a mandatory quarantine on all travelers from Tampa, Plant City, and Manatee. Any who fled to Jacksonville were arrested and sent to a quarantine complex near the city called Sand Hills Hospital. Cases of yellow fever increased through the winter, but would slow in Tampa by spring of 1888. Wehowever, Plant City would remain ridden with fever, and by May of the same year, the town would be put under quarantine. Weedon was one of many physicians working to fight the epidemic, alongside others, such as Dr. John Wall. Wall reported that around 1,000 had caught the fever in Tampa, and over 100 had died. But it is likely that these numbers were grossly underestimated. While yellow fever was on the decline in Tampa by early 1888, it would only rise elsewhere in the state. In Jacksonville, a city of 13,000, there were over 5,000 confirmed cases and at least 427 deaths. This would prompt the state of Georgia to impose a mandatory quarantine on all travelers from Florida who could not produce a card stating that they had already had the fever and were immune. Fever was spread by mosquitoes until 1901, and the generally accepted theory of the time was miasma, or the belief that sickness spread through bad air. Therefore, Wall's recommendation to the people of Tampa was better hygiene. In 1895, 7 years after the epidemic, Weedon and several other prominent members of the Tampa medical community founded the Hillsborough County Medical Society with the goal of solving public health problems that resulted from quote-unquote primitive conditions and rapid growth. 3 years later, in 1898, Weedon acquired a large island in Tampa Bay from his father-in-law and built a house atop a shell mound on the island. He would become transfixed with the archaeology of the island and even petitioned the United States government to have the island labeled a national park. Leslie Weedon died on November 12, 1937. Weedon worked his entire life to not only fight the dreaded yellow fever, but also as an archaeologist. Mosquito control techniques would be implemented in the early 20th century to combat mosquito-borne illnesses in the United States. And in the modern day, yellow fever is not nearly as much of a threat as it once was.